At the moment I'm working on the Diagnostics Development Unit, for which you can see some of the equipment behind me. This is a collaboration between atmospheric chemistry, space science and medicine, using the expertise from those three different fields to come together to try and make an early diagnosis in the emergency care patient. The most exciting part of the project for me is working with people that I don't usually work with, that have a different perspective on the sort of problems that I'm looking at. So I'm working with scientists from other areas of the university that have a complete different way of looking at a problem, and that's really very stimulating.
My group is interested in neurodegenerative disease, primarily Huntington's disease. Our approach is using model systems, so simple model systems like baker's yeast, which you use to bake bread and brew beer, and fruit flies, Drosophila melanogaster, to study some of the conserved basic mechanisms involved in neurodegenerative disease. I think our kind of work is really focused on maybe not so much curing, in the classical sense of the word curing a disease, but really trying to delay the onset of symptoms. Because if you can push back the average age of onset from 45 years of age to 75 years of age, then to some degree you won the biggest battle.
The research I'm doing at the moment is focused mainly on what we call the defensins, and these are the body's own antibiotics, and it's clear that they have a really important role in defending the body against infection. Really the reward actually comes from finding things out. And secondly, it can be applied as well. So yes, you're finding something out that's very interesting, that's pure science and satisfies your curiosity, but you can also apply it, and hopefully it might end up doing some good in the world as well. And generally building our knowledge of who we are and where we are, and you know, potentially where we're going.